Esther Muñoz present after that, and we'll take questions after that. Also present with us is the COVID-19 Task Force Chairman Warren Villagomez and the Governor's Authorized Representative Patrick Guerrero. That's me whenever you're ready.
Good afternoon, everyone. My name is Stephanie Fernally. As some of you know, I'm the regional epidemiologist, communicable disease epidemiologist for Pacific Island Health Officers Association, deployed here to the CNMI to provide epidemiology support. Today, I'll be giving you an update on our cases as of yesterday, November 22nd. So yesterday, we are reporting on 98 new cases identified yesterday. And so the case breakdown for those, we've identified 82 of those, vast majority, through our community-based testing, which was utilized by several different employers and community groups and general community members for testing for COVID-19, which was great. From those, every single one of those CBT cases we identified has a linkage to another case. And we've identified, I think, as I mentioned in the press conference yesterday, about some new emerging clusters that we've been able to identify among our cases, one of which is a large congregated living facility that we have identified a majority, 63 of these 82 CBT are associated with that living situation, which are in addition to an additional 28 previously identified that are all part of this large cluster that we've identified. We also have 19 additional cases from CBT that have known linkages to known ongoing clusters. That's great. We're able to identify and link all of our CBT cases to our known cases and our known clusters. In addition, 14 of the cases yesterday, new cases identified, 14 of which were identified through contact tracing, as we continue to identify cases and quarantine contacts and test them for COVID-19 to further reduce the spread and break those linkages and transmission. We also identified 2 cases through our ER testing. Although we still have 0 severe cases identified of COVID-19, which is great news, really is a testament to our high vaccination coverage, which reduces the risk of severe disease, as well as presence of our treatment options for COVID-19, our monoclonal antibodies, which we have here on the island and are actively assessing patients and cases for eligibility and administering those to continue to reduce the risk of severe disease and hospitalization. With that, our contact tracing team is ongoing to identify additional contacts and quarantine those contacts. Today, for these newly identified cases, our contact tracing team works around the clock to identify cases, and the majority of these identified through CBT were associated with our contact tracing team being able to work closely with employers and workplaces as well as community groups to encourage testing and register persons to go and get tested for those. With that, as we continue to identify new cases, although they are all linked to known clusters, we continue to encourage our community. I know Thanksgiving is coming up where we expect to see community gatherings, meeting with our relatives, having our Thanksgiving meals. And with that, just wanted to continue to remind the community our best prevention and our best protection is vaccination, of which we have a high vaccination rate. But just wanted to remind those, if you haven't yet, for those folks out in the community who want to know what best way to prevent themselves from having this potential virus being transmitted to them, their best way to do that is to get vaccinated. If you haven't yet gotten any shots yet, if you haven't gotten your first dose or completed a course, I really highly recommend you go and get a dose. 1 dose is better than no doses, and a full vaccine course is the best protection we can offer. For those of you who have already gotten all of your doses, you're fully vaccinated. Everyone 18 up is now eligible for a booster shot. Encourage everybody to go and get your booster shot. We know that even if fully vaccinated, our immunity can wane over time. That booster shot just bumps it right back up to a high efficacious vaccine to totally help reduce risk of severe disease and transmission. Can help prevent transmission within your household and within your community and protect you and those around you. As well as we now know that a couple of weeks ago now, vaccination is now available for our children, our 5 to 11-year-old pediatric age group. And so parents out there, we highly encourage you to get your kids vaccinated with this really safe and effective vaccine so that we can protect our kids, knowing that it takes a little while for the vaccine to start working. So once you get the shot, it takes a little while for your body to develop that immunity to this disease. So give your kid the best chance. Getting the shot today won't protect you on Thanksgiving, but it will protect you over the next 2 weeks once you ramp up to that high level of efficacy within 2 weeks. Everybody will be at a high level of efficacious after that shot. So for Thanksgiving, it's coming up. If you can consider a smaller gathering for you and your families. I know we all want to see our aunties and our families for Thanksgiving, but just consider, keeping yourself safe, protecting yourself and your family to try and limit those gatherings yourselves, maybe smaller groups and gatherings. Also, we know that this virus doesn't transmit as well outside. So I didn't check the weather report, so maybe it'll rain on Thursday, but if it does, maybe consider an outdoor Thanksgiving, go and soak up some sun or soak up some rain, whichever one comes for us on Thursday. Maybe go under a canopy for one of our enclosures outside. Just want to recommend that as another protective alternative for you guys for this Thanksgiving season, so we can celebrate together and celebrate in a safe way. So just with that, I'll go ahead and close kind of our case update for today. If you have any questions, of course, Gil will moderate, but that's it for me. Thanks, Gil.
All right, folks, now we'll have our CEO, Esther Munoz.
Okay, so I need my glasses. Thank you. All right. So we have this is the numbers are huge or large, and it is concerning for all of us as well. There's especially being in a congregated living, you are basically at risk. And even wearing a mask can even reduce the risk of infection by even 70%. So we are really urging individuals who have not gotten vaccinated to get vaccinated. We will continue to have the vaccination site open this entire week. Yes, we will be closing on Thursday, but I believe we will be reopening on Friday and Saturday as well. So the message that we're trying to convey today is, that COVID is definitely here. We have these cases that we're trying to contain, and that will be our goal moving forward. Again, continue with that goal of containing this virus from spreading out there in the community. There is going to be some outreach that we're working with the vaccination team to try to get to target population, to bring the vaccinations to them. And we're trying so that we can, again, get more people vaccinated. So we will, that's the message that we're trying to convey today is please continue to practice your 3 Ws. We are concerned with the community if they are not vaccinated, because as we're seeing again, we want to contain this. We want to have more immunity for a population, a targeted population. We want to be able to see in a workplace where there's more people vaccinated, so that people can continue their work and not have this distraction of closing down, establishments because someone has been detected as positive. But I want to express a huge appreciation to the governor, Gar, the task force chair, for all their work and support in trying to, identify, isolate, and also help us treat these patients or these individuals that require the treatment for monoclonal antibodies. And we're getting the good support from HHS and FEMA in order for us to respond to this situation that we're in right now. And we will continue to again do more outreach for vaccinations and also testing. We are going to be expanding testing for the community. This is, so in a way, it is perfect timing for us because of our new protocols at the airport. We're now able to even expand even further. So we're moving forward over everything else that we're trying to contain this situation right now. So I'm ready for questions also. I'll be available. Mr. Abel.
Sorry, moderator, I'm taking the moderator role.
No worries.
This is not like too official, right?
Thank you, CEO Munya, Gil, for coordinating. Stephanie, great presentation. Gar, this afternoon, and people, the CNMI, as well as the media partners. In regards to add to CEO Munya's reassurance, how safe we are in the CNMI, the task force is, stepping up a couple notch in regards to all efforts as well as resources that needs to be stood up, as well as shared, furnished to establishments as well as government offices that need PPEs. We are currently distributing PPEs to work areas that had infection to make sure and reassure that the services that provide continues on, as well as the safety for this community. So moving on to Rhoda and Tinian, we are in close coordination with the mayors in Tinian and Rhoda, as well as task force representatives that are down there to make sure that mitigation measures are in place in the event that an infection reaches those two islands. So with that said, we have enough isolation and quarantine rooms, working along with Patrick Guerrero, our GAR, to make sure that we have all the available amenities as well as infrastructure to continue to protect our islands. Have a great Thanksgiving, and thank you very much. Open for questions.
All right, media folks, if you could go ahead and raise your hands, I'll call on that order. All right, Tomas.
I just wanted to clarify, these 98 cases, are you reporting them in a matter of a day, or were they identified in a few days? It's quite a big jump. Is this 98 cases in the last 24 hours, or can you further clarify?
Hi, I can help clarify. So these cases were identified on the 22nd. We currently have CBTs available on a spaced basis. And so our last CBT was available on Friday. And so these were folks who maybe had registered for this Monday CBT. Today is Tuesday, right? Today is Tuesday. Okay, my apologies. I'm losing track of time. So this Monday CBT was the first CBT since last Friday. And so these cases, like I mentioned before, when we test somebody, it doesn't really tell us when they might have been infected with the virus. It's just when we were able to finally, swab them and test their sample. So the case investigations are ongoing to determine symptom onset. I think I mentioned it yesterday. It's kind of it's our best indicator for when these people may have been infected. It can tell us that incubation period and tells us sort of how long or when that person started to show symptoms of COVID-19. So those data are incoming. We're currently doing that. As you can imagine, it's a large number of cases, though all of these cases we've been able to identify and been able to isolate them and their close contacts, quarantine their close contacts already. So those folks were just waiting to get that data today on sort of the idea of when these might have been identified first. But yes, these are all newly tested yesterday positives, all 98. I hope
and you said about 82 of the 98 were through community-based testing. Do you have the total tests that were conducted? Because it would be out of that number, right?
That's correct. So I believe the number swabbed for CBT yesterday was 375.
Would that translate into a higher positivity rate than was reported yesterday, given that it's higher?
Yeah, so to clarify, so the CBT testing was both community members who were interested in being tested for either knowing their status or potentially because they knew that they had been contact to a case. We also had employers and community groups register their community members or their employees for utilizing our community-based testing for their screening of their employees or folks who live in these congregated living areas. And so we had folks register rosters of folks. So there's a bunch of different folks who are using the community-based testing, but you're right. So the overall raw positivity rate for yesterday would be higher. I believe it's I calculated it, I think it's around 20%. But yes, so on average, our CBT testing average up until yesterday is still low, under 5%. It is now around 2 to 3% is our average for all of our CBTs. Although this number is concerning, I think it's a positive that they were all part of known clusters, that we were able to link them back, and that these were folks that we can now identify. We were able to rapidly identify and isolate almost immediately after their tests, as well as their close contacts. So that was, I think, a positive there. I think the good thing here is that these were not individuals in the community who were all testing positive individually, so that there were 80 different individuals who now have additional close contacts. This is a groups of 68, I believe is the number that I reported. I can double check that. 63, my apologies. 63 all in 1 or 2 single congregated living facilities, and then 16 already associated with our known clusters that are known contacts to cases, which we've already identified, or part of community groups that we've identified transmission within, as well as other folks who are individual family members of known cases. So nobody that we, is a new name for us. These are folks that we already knew about or are on lists that we're acquiring.
And just my last question for Chair Warren Villagomez. I just wanted to ask you, I know we've been talking about how the community has come together, there are self-imposed restrictions. It's the holidays, schools are expected to open in the next few weeks. Is there a plan moving forward? What does the protocol indicate next if the spread continues to be at these rates?
Thank you, Thomas. And I have CEO Munya here with me. As what was stated by Stephanie, the number seems high, but we with all the efforts of the contact tracing, as well as DFAM resource, DPS, as well as Homeland Security, CACC, of course, we don't see that being at this moment because all efforts are on the ground.
Yeah, and I just want to emphasize that, again, since the beginning, we have not changed the way we are looking at these cases. We are still looking whether or not there are severe cases, and at this time there is none. So we are still, again, we have the treatment for individuals who need it. If they meet the criteria, they will be given the treatment, as well as we'll continue to push for vaccinations and reminding individuals to continue to practice VWs.
All right, thank you.
You're welcome.
All right, Sally, go ahead.
Hi, good afternoon, everyone. I just wanted to ask the vaccination status of all these, the newly confirmed 98.
Sally, thanks for the question. Case investigations are currently ongoing. We'll get those information hopefully soon, very soon. Yep, those we can share at a later date. Thanks for asking.
All right, thank you. And for the clusters, you did mention that there's a new emerging cluster, and if I remember correctly, previously CEO mentioned that there were 2 clusters in the beginning. So how many clusters in total are we looking at? Is it 3?
No, multiple. So we have 2 major clusters identified at the beginning, and one of those clusters continues to be active. We start still seeing cases that are linked back to that with almost 90 cases. Now more, haven't done the cluster analysis today yet with these newly identified, but these are all also linked to that large cluster. So large, almost I believe half of our cases since October 28th are linked to this one large cluster. But we do see that second cluster that was reported at the very beginning. That one, we haven't seen an active case associated with it for several weeks now. So we usually wait for 2 incubation cycles, which would be 28 days approximately, until we officially sort of call that one resolved. We haven't been able to identify a linkage to that. That's an active case. And this is based on symptom onset date, of course. We do see asymptomatic cases, of course. But we are seeing additional clusters in a couple of different exposure settings, workplaces, household settings. The number of clusters that are officially known as clusters are, I don't have that number in front of me right now, but we do see smaller household clusters that are linked to workplace exposures. And we also see, of course, exposures at community events. Think things like birthday parties or other gatherings between households. That's where we're also seeing exposures and some clusters emerging from those, from our community, sort of, seeing family and friends. We know that that's really the time when we're at our guard is maybe a little bit lowest, maybe not practicing the 3 W's as religiously as we'd like. So those are kind of some of the exposure settings that we're seeing emerge into additional clusters. Does that help answer your question?
Yes, thank you so much, Stephanie. And my last question is directed to Chairman Warren. We are looking at COVID within the community, but we are also interested in knowing, have any of the tourists that have come in from the travel bubble tested positive for the virus? Because if they have, it would have also affected, our SciFi community, our local community that's at Kensington.
Great question, Sally, and the answer is no. The Korean travelers have been very, safely coming into CNMI, but we are doing everything as protocol, asked, as well as pre-arrival swabbing to the CNMI. Thank you.
All right, thank you so much, Chairman. That's all the questions I have.
All right, thank you, Sally. Kay, you're up.
Hi, yes. I just wanted to ask for the new cases, or I guess just new cases that are identified through contact tracing. How long are they individuals isolated for, and what sort of requirements or criteria would they need to meet in order to be released back into the community?
Okay. Good question. So our isolation and quarantine protocols remain the same. For those close contacts identified and quarantined at the quarantine facility, those individuals are tested on day 1, of course, and tested on day 5. So release from quarantine requires a day 5 negative test, or if they result positive on either their day 1 or day 5 test, of course, we're going to isolate those folks for an additional 10 days. So that's our current protocols, and it remains the same.
And then are all of the new cases, are they all symptomatic?
No, not all of the new cases are symptomatic. Again, our case investigations are ongoing, so that breakdown asymptomatic, symptomatic is forthcoming, but not all of the cases are symptomatic.
Thank
We
you.
know with this particular virus, the asymptomatic, symptomatic usual spread is a little bit higher on the asymptomatic side, especially with this Delta variant, which is still unconfirmed. That's what we have here, but our genetic sequencing, the flavor of the month in the entire world is Delta. So I wouldn't be surprised to see that one become our strain here. But with this one, we do see a larger proportion of cases are asymptomatic, although they can still spread, though they do not display symptoms. So we know that these cases identified, some of them are asymptomatic, of course, but the exact breakdown forthcoming. Thanks for asking.
Okay, thank you. That's all I have for now.
Mm-hmm.
Thank you, Kay. Josh, you're up. Joshua?
Hello?
Yes, sir, we can hear you.
All right. Good afternoon, everybody. So perhaps this could be a question that I could ask Governor Torres, but in the meantime, is there maybe possibly discussions on bringing us from community safety level green to blue? Is there a need for that at this time? Probably.
No, I mean, the community level is still, we're monitoring it. We're seeing the connections to linkage to our original clusters. So we're not at that discussion yet. Not discussing that with the governor at this point. I mean, we wanted to express to all of you the numbers, of course. Obviously putting out a press release about the numbers can be surprising for some, and that's why we wanted to make sure that we're here to answer your questions about these cases. We will have more information as we get them. as the contact tracing continue to do their job in collecting information. You know, I also want to ask individuals that if you are, you know, contacted by the contact tracers, to give us as much information as you can. We want to be able to contain this as quickly as possible. Some of the information we received were actually delayed, and sometimes I think in some ways they were not disclosed to us in a timely manner. We would like for individuals to, as I believe, I don't know who said this before, but we're trying to help, and we're also, you know, trying to close these cases. In order for us to do that, we need as much information as we can. So, you know, since the beginning, we said that if you are experiencing any symptoms, that you go to the provider, you know, the CHCC provider, because we have the ability to test and find out if you are infected with the COVID-19. We also said that, you know, share the information about reaching out to the contact tracers. If you feel that you are a contact, maybe you know someone, you know, reach out to us and we can put you in the schedule and put you in the slot. Even if it's full, we can put you in there so that we can test you. And you know, even if you're worried, even if you're just worried, that's what we're trying to do now, is to open the gap. I mean, open more slots for individuals to get tested. You know, open more days. That's what we're targeting right now, is to have it available more days. And we're also even opening the testing access to enrolled Antinian as well. So, you know, there's ways to contain this, and it's a matter of testing and isolating individuals that have already been identified as positive. And, you know, again, I mentioned about how grateful we are that we are able to do that. You know, if we aren't able to do that, there's continuous risk. And we are trying to quickly minimize the risk, continue to emphasize the need to practice 3W so that we can contain this. We can do it. There's nothing to stop us from doing that. We just need everybody's help. We need everybody's support and assistance to provide information so that we can close the gap. I understand some people may be afraid to share some information because they don't want to, you know, they don't want to be in quarantine. But, you know, this is about closing this, closing these cases, and we really do need your help. And if there's anything else that we can do to help you be a solution to this problem, please let us know. You know, Gil can share my email, you know, and find out, so reach out to me and how we can help us, okay?
All right. And then my second question is, so in its own announcement yesterday, Mount Carmel School said they had one student test positive, and they went through with the school went through with its own COVID response, and they took care of that. On that note, moving forward, if there was going to be like a case or cases at a PSS school, for instance, what is the game plan in that case moving forward?
Josh, so we have messaging that we can share with CDC. It's basically guidelines that businesses or organizations can do to prevent the spread of COVID-19, and I'll share that with you folks. If you folks can help us out with that messaging, that would be grateful. We would be appreciative. But really, it's really determined on the organization themselves how they choose to respond, but we can share CDC guidelines.
Gil, can I just add?
Yes.
Yeah, I just wanted to add also the PSS schools have developed their own protocols and their own, apologies, I didn't go on the camera, so I didn't know if I needed to. So the PSS schools have their own game plan that they've developed in coordination with CDC guidelines and as well as coordination with CHCC that they've shared with us. And they have their game plan ready. So they've already developed their own protocols for these types of exposures. So, you know, it's a great thing that the organizations are taking, you know, their responsibilities. You know, cases in each organizations are, you know, part of their responsibility as well, and you know, engaging in collaboration between our contact tracing team as well as those organizations where those cases are identified is a critical step for us and a key part of our response for these cases to further, identify contacts and be able to rapidly isolate and quarantine them and test their close contacts as well. So they have their plans already in place, protocols. Yep.
One more
Sure.
thing.
All right. Noted.
Can I just add one more thing? In regards to monoclonal antibodies, the sooner we get the treatment to you is the better. So if you are early course of your symptoms is the best way to get this treatment. And so again, if you have symptoms, even mild symptoms, please reach out, go to the clinics or the emergency room. Thank you.
All right, Josh, got it? Okay, thank you, Josh. Dana, you're up.
Hi, I guess this would be for Stephanie. Could you give us, just run through the updated numbers of total cases, cases since the October 28 outbreak started, and maybe, how many are active now, how many people are hospitalized now?